Human left lung, full detailed explained. Human left lung, full detailed explanation, medical animation in 3. Have you ever wondered how your body takes thousands of breaths every single day without you even thinking about it? Deep inside your chest, a remarkable organ works non-stop to keep you alive, the lungs. But today, we're focusing on one specific part of this incredible system, the left lung. The left lung is not just a copy of the right lung. It has its own unique shape, structure, function, and special adaptations that allow it to fit perfectly beside the heart. In this complete guide, we'll explore the anatomy, structure, blood supply, microscopic details, breathing mechanism, functions, diseases, and fascinating facts about the human left lung. Chapter 1. What is the left lung? The left lung is one of the 2 lungs located inside the chest cavity. Humans have right lung, left lung. The lungs are part of the respiratory system, responsible for bringing oxygen into the body and removing carbon dioxide. The left lung is located on the left side of the thoracic cavity, protected by ribs, resting above the diaphragm, beside the heart. Unlike the right lung, the left lung is smaller because the heart occupies part of the space on the left side of the chest. Average measurements. Weight, approximately 450 to 500 grams. Length, around 25 to 30 centimeters. Color at birth, pink. Adult color, pinkish gray. Chapter 2. Why is the left one of the most interesting questions is, why is the left lung smaller? The answer lies in the position of the heart. The heart sits slightly toward the left side of the chest. To create space for the heart, nature designed the left lung with a special indentation called the cardiac notch. Because of this, right lung equals larger. Left lung equals smaller. The left lung has 2 lobes, cardiac notch, lingula, while the right lung has 3 lobes. This difference helps maintain proper space inside the chest cavity. Chapter 3. Lobes of the left lung. The left lung contains 2 major lobes. Superior lobe. The superior lobe forms the upper part of the lung. It contains apico-posterior segment, anterior segment, superior lingular segment, inferior lingular segment. Functions: receives oxygen-rich air, participates in gas exchange, helps maintain respiratory efficiency. Inferior lobe. The inferior lobe forms the lower section. Functions: major area for gas exchange, larger breathing surface, receives large airflow during deep breathing. Lingula. The lingula is a tongue-like projection found in the superior lobe. The lingula acts similarly to the middle lobe of the right lung. Chapter 4. Surfaces and borders of left lung. The left lung has several surfaces. Costal surface, faces ribs, smooth and convex. Mediastinal surface, faces the heart, contains impressions of nearby structures. Diaphragmatic surface, rests on diaphragm. Borders include anterior border, posterior border, inferior border. Chapter 5. The hilum. Gateway of the left lung. The hilum acts as the entry and exit point of important structures. Major structures entering and leaving: pulmonary arteries, pulmonary veins, main bronchus, nerves, lymphatic vessels. Think of the hilum as the lung's transportation center. Chapter 6. Bronchial Tree. Air travels through a complex branching system. Path of air. Nose to pharynx, to larynx, to trachea, to left main bronchus, to smaller bronchi, to bronchioles, to alveoli. The left main bronchus, longer than the right bronchus, narrower, more horizontal. The bronchi divide repeatedly like branches of a tree. Chapter 7. Alveoli, tiny air sacs. Inside the lung are millions of tiny air sacs called alveoli. Approximate number, around 300 to 500 million alveoli in both lungs. Functions of alveoli. Oxygen enters blood, carbon dioxide leaves blood. Increase surface area. If all alveoli were spread out flat, they could cover nearly an entire tennis court. Inside the lung are millions of tiny air sacs called alveoli. Approximate number, around 300 to 500 million alveoli in both lungs. Functions of alveoli. Oxygen enters blood. Carbon dioxide leaves blood. Increase surface area. If all alveoli were spread out flat, they could cover nearly an entire tennis court. Gas exchange occurs inside the alveoli. Step 1. You inhale oxygen. Step 2. Oxygen enters alveoli. Step 3. Oxygen diffuses into blood vessels. Step 4. Red blood cells carry oxygen throughout the body. Step 5. Carbon dioxide moves back into alveoli. Step 6. You exhale waste gases. This process happens continuously every second. Chapter 9. Blood supply of left lung. The left lung receives blood from pulmonary arteries, carry oxygen-poor blood. Pulmonary veins carry oxygen-rich blood. Bronchial arteries supply lung tissues. Without this blood supply, lung cells could not survive. Chapter 10. Diseases affecting the left lung. Common conditions include pneumonia, asthma, tuberculosis, lung cancer, pulmonary fibrosis, chronic bronchitis, emphysema. Symptoms may include coughing, chest pain, shortness of breath, wheezing, fatigue. Chapter 11. Amazing left lung facts. The left lung is smaller than the right lung. It has only 2 lobes. It contains a cardiac notch. It works continuously throughout life. Millions of alveoli work every second. Adults breathe around 20,000 times daily. Lungs are among the body's most important organs. The human left lung may be smaller than the right lung, but its role is enormous. Every breath you take depends on the extraordinary structures hidden inside this amazing organ. From bronchi and alveoli to oxygen exchange and blood circulation, the left lung works every second to keep your body alive. If you enjoyed this detailed medical animation, subscribe, like, and stay tuned for more human anatomy explanations. Additional deep details for human left lung. Chapter 12. Development of the left lung before birth, embryology. The lungs do not suddenly appear at birth. They begin developing while a baby is still inside the mother's womb. Stages of lung development. 1. embryonic stage. Lung buds appear from the primitive foregut. Main respiratory structures begin forming. 2. Pseudoglandular stage. Bronchi start branching. Airways become more complex. 3. Canalicular stage. Blood vessels grow rapidly. Future gas exchange regions begin developing. 4. Saccular stage. Primitive air sacs form. 5. Alveolar stage. Mature alveoli develop. Continues even after birth. At birth, lungs suddenly expand with air for the first time. Chapter 13. Pleura, protective covering of the left lung. The left lung is covered by a thin protective membrane called the pleura. There are 2 layers. Visceral pleura directly covers the lung surface. Parietal pleura lines the chest wall. Between them is pleural cavity. This space contains a small amount of lubricating fluid. Functions: reduces friction, allows smooth lung movement, helps maintain pressure inside the chest. Chapter 14. Microscopic structure of the left lung. Under a microscope, the lung looks very different. Main structures: respiratory bronchioles, tiny air passages carrying air deeper into the lungs. Alveolar ducts, small channels leading toward alveoli. Alveolar sacs, clusters of air sacs. Capillaries, extremely small blood vessels surrounding alveoli. The walls are extremely thin, so gases can move quickly. Chapter 15. Cells found inside the left lung. Different cells perform specialized functions. Type 1 pneumocytes. Functions: form most of the alveolar wall. Allow oxygen diffusion. Type 2 pneumocytes. Functions: produce surfactant. Repair damaged cells. Alveolar macrophages. Functions: remove dust, destroy bacteria, clean inhaled particles. Chapter 16. Surfactant, the invisible protector. The lungs produce a special substance called surfactant. Functions: reduces surface tension, prevents collapse of alveoli, makes breathing easier. Without surfactant, breathing becomes difficult. Alveoli may collapse. Premature babies can have breathing problems because surfactant production may be incomplete. Chapter 17. How breathing actually happens. Breathing involves muscles and pressure changes. Inhalation. During inhalation, diaphragm contracts, chest cavity expands, lung volume increases, pressure decreases, air enters lungs. Exhalation. During exhalation, diaphragm relaxes, chest cavity becomes smaller, pressure increases, air leaves lungs. This process repeats continuously. Chapter 18. Nervous system. Control of the left lung. Breathing is controlled automatically by the brain. Important brain regions: medulla oblongata, pons. Functions: monitor oxygen levels, monitor carbon dioxide levels, adjust breathing speed. When you run, oxygen demand increases, breathing becomes faster. Chapter 19. Left lung and the heart relationship. The heart sits very close to the left lung. Special adaptations: cardiac notch. A curved indentation allowing space for the heart. Lingula, small projection beside the heart. The left lung and heart work together. Heart pumps blood. Lung oxygenates blood. Oxygen-rich blood returns to the heart. Chapter 20. Interesting left lung facts. The left lung is approximately 10 to 15% smaller than the right lung. Humans breathe around 20,000 to 25,000 times daily. Lung tissue can expand dramatically. Millions of alveoli participate in gas exchange. Even while sleeping, the lungs continue working. The lungs and heart form one of the body's most coordinated systems. Extended outro. The human left lung is far more than a simple breathing organ. It is a highly organized biological system containing airways, blood vessels, microscopic cells, protective membranes, and millions of alveoli working together every second of life. From the first breath after birth to every breath throughout adulthood, the left lung continuously supports the body with oxygen and helps maintain life.